One of the ways we treat a herniated disc is flexion distraction technique. With this technique, we strap your feet in, the table's gonna open up and distract the spine about 4 inches and drop down about 4 inches. This is gonna give a gentle stretch to the spine. It's a really gentle technique to help stretch the ligaments of the spine, take some of that pressure off. What it also does is create a negative pressure in the disc as we open up the joint, which allows that herniation to migrate back in, but it also just separates that herniation from the nerve root. So we get some gentle motion in the spine, help open things up, take pressure off of that nerve. It's causing that sciatica down the leg. And we open up. So it's similar to an inversion table, but much more specific, where we can target each individual vertebrae. So another way we often treat herniated discs is with McKenzie press-ups. So after proper classification, a lot of times with a herniated disc, we want to classify, does our patient need extension or do they need more flexion? Sometimes there can be a lateral component, but usually it's flexion or extension. So with the McKenzie press-up, we're actually doing kind of the opposite of the traction. I'm going to have the patient press up and down and up. A little bit of overpressure and down, up. So what we're doing here is helping to restore some of the natural curve extension to the lumbar spine. And as we're putting pressure through extension, as he's working through that, it's allowing that disc either migrate back in and really just unlock the vertebrae and take pressure off of the nerve in the low back. So oftentimes with a bulging or herniated disc, we're looking at the spine, what's going on in the back and the spine, but also with that sciatic nerve irritation, a lot of times the body's going to develop a lot of trigger points in the muscles associated with that sciatic nerve, our hip and piriformis, hamstring, calf, depending. So oftentimes we're always looking at the patient's hips and working some hip mobility here. So what I'm going to do, knee to chest, foot to the floor, sky, and back. Keep going. Down, up, and back. Down, and back. What this is doing is help taking pressure off the piriformis muscle, which takes pressure off the sciatic nerve. Down, up, and back. Down, up, and back. Another common muscle that gets irritated when we have sciatica or herniated disc is the hamstring muscle. So oftentimes I'm not always just trying to stretch it, but really work out those tender trigger points and free up that sciatic nerve. Common spot it gets entrapped is the mid-belly of the hamstring here. So we're gonna just work that out for Anthony. As I come up, let that arm fall back for me. Good. Just adding a little tension to the sciatic nerve here.